A lot of individuals get HMO and PPO confused, or they think it's the same thing. In today's video, we're going to break down the difference between a Medicare Advantage HMO versus PPO. Hello there, my name is Patricia. Thank you for joining us in today's video. I'm a registered nurse. However, I focus on helping my clients understanding Medicare. So let's get right into it. Let's start with HMO Medicare Advantage plans, and let's start with provider networks, okay? So when you have an HMO plan, you have to stay within a network unless it is an emergency. So these doctors, providers, hospitals have agreed with the terms of this plan. So you have to stay within a network, okay? So you have to make sure you see a doctor or a hospital or a specialist that is in the plan's network. If you decide to see doctors outside of the network, then you would pay for the full cost unless, like I said, it's an emergency, okay? So let's start with choosing a primary care doctor. So if you have an HMO plan, it is required that you go ahead and choose a primary care doctor. Your doctor usually needs to be on the insurance card, and usually the doctor will not see you if his name is not on the card. So it's very important that when you choose a HMO plan, you go ahead and also choose your primary care physician as well. Now let's talk about referrals. So when you are on an HMO plan, a referral is required to see a specialist from your primary care doctor. So if you want to see a specialist, whether it's a pain doctor, whether it's a doctor for your diabetes, high blood pressure, it doesn't matter. You would need to go to your primary care doctor to see that specialist, whether it's a cardiologist, pain management, a orthopedic surgeon. It doesn't matter what the specialist is. It is required for you to get a referral from your primary care physician. Now let's talk about the cost of an HMO plan. Now, generally, when you get on an HMO plan, the copays will be lower and your max out of pocket would be a lot lower as well. The reason why the cost is a lot lower than a PPO is because the providers and the hospital, everyone in that network have agreed on the cost and the copays of that plan, which brings down the cost of the plan overall. So your copays would be lower and your max out of pocket would be lower as well. The flexibility of using an HMO plan, you're going to have less flexibility because, like I said, you have to stay within network, right? You have to use those providers within network. However, like I said, the cost is a lot lower. Benefits, when we're talking about an HMO plan, usually benefits would be a lot more because you have a restricted network. So you get more dental, vision, hearing, and other benefits that the plan may offer. Usually you'll see a little more benefits than a PPO plan, okay? Now let's talk about PPO plans, PPO Plan Networks. Now, when it comes to a PPO network, you could go in and out of network. Now, if you choose to see doctors outside of the network, then you will pay a little more for those providers, but it's nice to know that you can see doctors in hospitals in and out of network. The next thing we want to talk about is a primary care physician. Is a primary care physician required like the HMO? So usually a primary care physician is not required to be listed on your health insurance card, which is really nice because that allows you to really see doctors in and out of network. Usually a doctor would not require you to have their name on that PPO card because, like I said, you can't see doctors in and out of network, and a primary physician is usually not required when choosing this plan. Referrals, when you're on a PPO plan, you do not need to have your primary care physician or any physician for that matter to give you a referral to see a specialist. You could just go ahead and call the specialist and just ask them if they're taking that PPO plan. And if they say yes, you can go ahead and make your appointment. So a referral is not required by another physician. So that is really nice when it comes to a PPO plan. Now let's talk about costs when it comes to a PPO plan. Because you can see doctors in and out of network, the copays tend to be a little higher to see doctors outside of the network, and your monthly premium for that PPO plan may be higher. Now, I would say this, most Medicare Advantage plans, monthly premiums are zero, but some PPO plans do have a monthly premium, so keep that in mind. And your max out of pocket would be a lot higher on a PPO plan versus an HMO plan. So when you pick a PPO plan, usually the cost will be higher than an HMO. Flexibility when it comes to a PPO plan, there is a lot more flexibility because, like I said before, you can see doctors in and out of network, but remember, you're going to pay a little more for that flexibility. So there is a increased cost to have that flexibility, but a lot of individuals do not mind it because they don't like to ask for referrals and they don't have to worry about picking a primary care physician. And like I said before, you can see doctors in and out of network. Benefits with the PPO plan, most likely the benefits would be a lot less than an HMO, such as dental, vision, hearing, and other benefits. Those benefits you would see if you look at the difference between an HMO and a PPO, you would clearly see that the PPO benefits will be a lot less than the HMO benefits because, like I said, you can see doctors in and out of network. Okay, so who would be the perfect person for someone that wants to go on a HMO plan? I would say for someone that doesn't care about networks, they're okay with staying within the plan's network and they want to pay a lot less and they want more benefits, I would say that person would be perfect for an HMO, especially for someone that doesn't have a lot of doctors, that doesn't see a lot of specialists. Why pay more for a PPO if you only have one primary care physician and he's in your plan's network? So if this is your situation, then I will highly recommend an HMO plan. Who is a great candidate for a PPO plan? I would definitely say for someone that doesn't mind paying a little more copay, higher max out of pocket. You don't mind paying more for more flexibility because you can see doctors in and out of network. Someone that doesn't want to deal with the hassle of referrals and such. So that would definitely be a great candidate for someone that wants a PPO plan. And also, if you see a lot of providers, if you see a lot of specialists, if your specialists are not in network, then a PPO would be a great option for you. Of course, just because you have a PPO, it doesn't mean you can see any doctor. The doctors still have to agree on taking that PPO plan as well. Thank you so much for watching this video. I hope I made it very clear on the differences between an HMO plan and a PPO plan. If you need help with anything that we talked about in today's video, you need help with Medicare, give our office a call. We'll be more than happy to assist you. If you know anyone that can use this information, share this video with a friend. If you have any questions, comments, let me know in the comment section. I'll be more than happy to answer your question. And if you're not subscribed, subscribe to the channel to see me again. Thank you so much for watching, and I'll see you on the next video. Ciao for now. Bye.